my name is Michael Chen. I am a clinical professor at family medicine in the University Hospitals. I work out of Streetsboro, Ohio. Today we're going to talk about non-insulin ways to treat diabetes. So this is something that's super common and something that you'll be seeing plenty of. Typically, to diagnose diabetes, we look for either hemoglobin A1C of above 6.5, or if someone has a fasting blood glucose above 126. Quite honestly, this is kind of a not very specific finding, the fasting blood glucose. And so if you see someone with 126, you want to confirm with A1C, which is, as you remember, the average blood sugar over 3 months. So the very first thing to do for diabetes, which is something that patients oftentimes don't like to do, is diet and exercise. And this should be part of any kind of regimen for treating diabetes, decreasing the amount of carbohydrates that they eat and trying to burn more calories. Something that we typically do, the first line medication that we use is metformin. Metformin is an old, cheap, and effective medication. Oftentimes you can get an A1C drop of about 1, which is quite good for metformin. Common side effects are bloating and gas during the first month, but usually gets better. In old, kind of sick and elderly patients, you can have risk of metabolic acidosis, which can happen especially if you're in renal failure. So with adults, you're not supposed to use metformin unless the creatinine is below 1.6 in men and 1.4 in women. Beyond metformin, there's other oral medications that you can go to. There's some that are cheaper that you might consider first choices, but to be honest, each of them has their own issues. So the next ones that we oftentimes consider anyways is the sulfonylureas. There's the ones that we typically use are glipizide and glimepiride. And these work by kind of forcing your pancreas to secrete more insulin, which is quite effective. Usually it's about a 1% A1C lowering. But if you think about it, you're kind of thrashing the pancreas and kind of beating the insulin out of it. And so part of me is concerned using these that it causes people to go towards being insulin dependent before they would have otherwise. The other issue is these can cause hypoglycemia and weight gain. But the good thing is that these are cheap, very cheap, and they're pretty much like $10 per 3 months, which is very cheap. So for especially elderly patients who don't have good insurance, oftentimes they want these medications because it's cheaper than the other ones. There's also glyburide, which is also sulfonylurea, but it lasts a long time and increases your risk of hypoglycemic episodes. So I don't typically use it. So we typically recommend glipizide or glimepiride if you're going to go with the sulfonylurea. Next up, there's TZDs. And there's only one on the market right now. It's Actos. It's pioglitazone. It's not generic, so it doesn't cost too much. I'll call it $2 signs. It is quite effective as well. It gets the A1C down about 1%, usually about 0.9% or so. It's effective, but it also causes weight gain. No hypoglycemia. In some patients, it will increase their risk for getting heart failure, and it's not uncommon for people to get swelling from TZD. And in rare cases, we're finding that there's also a risk of bladder cancer from TZD. So again, not a medicine that we love, but it is cheap and it is effective.